Hi, and welcome to this video. In this video, I'm going to be talking about blood flow, specifically inside the heart. The first thing to kind of note here before we get started is that the heart has four chambers. Chambers is basically kind of like a section of the heart. So if you want to draw like a tiny table, on the first row, put left and right. And on the second row, write atrium and ventricle. And then you can kind of match each term in each row to the terms in the other row. So this would be atrium with left, atrium with right, and then you would have ventricle with left and ventricle with the right. So our four chambers are the left ventricle and the right ventricle, and then the left atrium and the right atrium. If we split this diagram vertically, you can see that we have the right atrium and the right ventricle on the left side of the diagram, while we have our left atrium and our left ventricle on the right side of the diagram. I know this is flip-flopped, but if someone was actually having this heart inside of them, in their perspective, it is their left and their right. Kind of like how a teacher at the front of the classroom, if they are facing all their students and they say, turn left, the students would turn in this direction because this is left in their perspective, while in the teacher's perspective, this is left. So we are going to be doing it kind of like this is the teacher's perspective. We're going to go ahead and have our blood start in the SVC and the IVC, and they're going to enter in the right aorta. This is unoxygenated blood, so this has no oxygen in it. That's kind of what unoxygenated means. Then the blood from the right atrium is going to flow into our right ventricle. This is going to be done through a valve called the tricuspid valve. A valve is basically saying that if you have a tube, we want the blood to continue moving in one direction. To prevent it from going in the other direction due to gravity or any other force, we have a valve which just prevents the blood from going back down. It has to go in the direction it needs to because this valve is blocking it from going elsewhere. So we have the tricuspid valve here, and it's going to enter the right ventricle. How do you know which one's on top between the right atrium and the right ventricle? Well, just know your alphabet. A comes before V. The atrium is on top of the ventricle. The ventricle is going to kind of push that blood into what we call the pulmonary artery. And the pulmonary artery just leads to the lungs here. And this is going to be done through another valve called the pulmonary valve. So same name as the pulmonary artery, pulmonary valve. At the lungs, what the lungs does is that you can tell when you breathe in and you breathe out that the lungs brings the oxygen that you just breathed in and kind of exchanges it with the carbon dioxide that you breathe out. So this turns the unoxygenated blood into oxygenated blood. This oxygenated blood is going to return to the left atrium through something called the pulmonary vein. So the pulmonary artery brings it to the lung, the pulmonary vein brings it back. And it's going to go to the left atrium here. And through something called the mitral valve, also known as not the mitral valve, but the bicuspid valve. And this might be a little bit easier to remember because the first one was tricuspid, and now we're dealing with the bicuspid, so that might be a little bit easier to remember. It's going to go through the left ventricle, and it's going to be pushed to the aorta, and in the process, it's going to go through the aortic valve. The aorta is just going to bring it to the body, and the body is going to use the oxygen and bring unoxygenated blood into the SVC or the IVC to restart the process. So now that you understand kind of how the blood flows, how can we memorize it all? Well, first you can use this acronym right over here that the right side is bringing the blood right to the lungs. So through this process, remember that the pulmonary artery brings it to the lungs to get oxygenated. In order to remember the left side, you can say, well, the blood that just left the lungs is going to be dealt with on the left side. In order to remember which one of the valves comes first versus the tricuspid and the bicuspid, you can say, well, you need to try before you buy. So that basically means that you have the tricuspid valve before the bicuspid valve. So I hope this video was helpful, and see you in the next video.